or mouse functionality. I'll have to use the touchpad.
Get your stuff together, Media Man.
Good afternoon. My name is Chris Bird. I'm here on behalf of the Coastal Bend COVID-19 Pandemic Task Force, and we're here to give you your weekly update on the pandemic. The purpose of the task force is twofold. One, it's to address your concerns and questions about COVID-19 and the interventions taking place to combat it, as well as to enable evidence-based decision-making on behalf of our local leaders. There are several interventions taking place right now for COVID-19. We're still in the red zone according to nuecasknows.com's risk dashboard. So it means extreme risk for contracting COVID-19 in the general public. You're urged to stay at home if you can. There's a governor's mandate right now to wear face coverings and social distance in public places, especially when indoors. And the federal COVID task force updated the recommendations to for everybody to try to double mask with one of those surgical masks and then covered by a cotton mask that increases its effectiveness to 91%, which is almost at the level of the N95. You're urged to isolate when exposed or symptomatic. Schools are either partially remote or all remote. It seems like this January there was a lot more all remote schooling that started to take place locally. And we're presently with businesses at 75% of their operating capacity, with bars open but at 50% of their operating capacity. So in the Coastal Bend, we're at 37,934 total cases of COVID-19. These are confirmed cases. That's since the beginning of the pandemic, with 33,785 recoveries. The thing that we're really focused on right now is the number of active cases, which is slightly up compared to the number that we presented last week, and we're at 3,581 this week. We have some positive news for once, and that's that it looks like the transmission rate might be below 1, or at least it's probably below 1. Right now, based on our best fitting of the model to the data, we're at about a transmission rate of 0.82 to 1.03. I'll remind everybody that what a value of 1 means is that every person that contracts COVID on average transmits it to one more person. That's enough to keep COVID going at the same rate. When that number goes below 1, it means that there's a good probability that some people won't transmit it to any additional people, and that leads to COVID subsiding. So right now, there are 2 models that are equally good fits to the data. One of the models, or one of the scenarios, it's the same model but 2 different sets of parameters, indicate that there was a dip earlier in January in the transmission rate, followed by a rise back up to about where it was. And the second model, which seems equally likely right now, is one where we dipped down and stayed down, starting at about the end of the first week in January through present. And so that's where we get this range from 0.82 to 1.03. So the transmission rate's probably below 1. And just as a calibration point, this was the dip due to Thanksgiving. And this latest dip, we're unsure of the cause right now. It might be related to people changing their behaviors once the vaccines started getting released, but we don't think, at least right now, that this is a direct result of vaccinations. Moving forward, so that model with transmission rate can be used to project the number of new cases per day. And the black dots here are the actual number of new cases per day in the coastal bend. And then the colored lines are the projections. Last week's projection is here in orange, and you can see that thankfully this projection didn't come to pass. And these new projections, these are the new ones, are more likely. So we've got our upper end of the projection here with that transmission rate at 1.03 right now, following a brief dip in the transmission rate, and the lower blue line here, this is our transmission rate at 0.82 or so. And so we think that reality is somewhere between these numbers, and if these transmission rates carry forward, then this is the range in which we expect the trend to continue, somewhere between this upper line and this lower line. You can see if we go out a month or two that the projection from last week does start to converge with the one from this week, but just there's fewer people contracting COVID, which is a better projection for us than last week. Okay, if we break down the number of new cases per day by county in the last month in the coastal bend, this is what we get. And Nueces has many more new cases per day than any of the other counties, because there's more people in Nueces than the other counties in the coastal bend. But that number is declining if you look over the past 4 weeks. If you look over the past week, it's increasing slightly. That's part of the reason why we have some uncertainty in the estimation of the transmission rate. And when we see the next batch of new cases over the next week, we'll see if this downward trend over the past month continues, or if this last week trend of increasing continues. Looking at other parts of the coastal bend, you can see here at least Jim Wells and San Patricio lead the rest of the coastal bend in terms of new cases per day. San Patricio only reports once a week, so that leads to these dips like you see here and then presently. But they should be releasing their numbers today. We just don't have them in the data that we download from the state to make these graphs. Zooming in on just the other 11 counties in the coastal bend, ignoring Nueces, and breaking them up into the ones that are increasing, only Clayburgh in terms of new cases per day. The ones with no trend over the last month, San Patricio, Aransas, Refugio, Brooks, and Kennedy. And then this is a welcome sight. The ones that are decreasing, besides Nueces, Jim Wells seems to be subsiding slightly over the past month, B County, Duval, Live Oak, and McMullen. So hopefully more counties start moving over from the no trend or increasing into this decreasing category. Looking at the metro areas in South Texas, we can see that there's a pattern where most of the locations are peaking. While it looks like Laredo is still going up, just the way the smoother is set, it can't get a peak as sharp as what Laredo just went through, but I can tell by comparing this to last week that this is a peaking pattern, and Laredo is on the way down right now in terms of new cases per day. San Antonio on the way down, Victoria right and Brownsville right near the peak, McAllen right near the peak, Nueces on the way down, and Aransas on the way down. So this is a better outlook than we were looking at last week. When we look at the whole state, we find that this isn't just a local pattern or a South Texas pattern. This seems to be, for the most part, a statewide pattern. These are the different public health regions in Texas, and the only public health region that's solidly increasing in terms of new COVID cases per day, in this case per 100,000 people in the population, is this West Texas region of El Paso and Lubbock. And the rest of the state is either declining, like Amarillo in North Texas, or has peaked already, like Dallas, the Dallas-Fort Worth area, or is on the way down or at the peak right now. So hopefully this trend of peaking and decline across the state for the most part will continue, and we'll be able to tell as new data comes in on that. Moving on to the hospitalizations, the thing with the hospitals, the parameter that we're most concerned with in terms of how it affects our everyday lives here in the Coastal Bend and how burdened the hospitals are, is this the percentage of the staffed beds that have COVID patients in them. This is used by the state to turn on and off the rollbacks of business capacity. So if this number goes above 15% for 7 days in a row, then that triggers businesses to roll back to 50% of their occupancy or of their capacity, and bars to close. Now you can see that we've only had 1 day above 15%, and that was quickly followed by a day below 15%. And in the past week, we're seeing a decline. So this pattern of a peak that we saw in the cases is also occurring to some degree in the hospitalizations. And even though there has been a slight increase in the number of staffed beds at our hospitals, there still has been overall a slight decline in the number of COVID patients in the hospitals overall on each day. So this has us moving in the right direction, which is down. Hopefully that continues. Focusing on the ICUs. This graph in red shows the number of patients that have COVID in the ICU. Today that's 60. And the number of patients that don't have COVID that are in the ICU, and today that's at 145 for a total of 205 patients in the ICU in the Coastal Bend. If you look at the patterns of patients in the ICU in the Coastal Bend, you'll see that before this summer peak, the average number of patients was somewhere around 150, maybe slightly below. That's what this blue dashed line represents. And you can see recently, over the past couple of weeks, the capacity of our ICU has increased. And I think that's in no small part related to the increase in the number of staffed beds that we've seen. There was about 100 bed increase, 100 staffed bed increase in the local hospitals over the past couple weeks, and that seems to be translating into maybe about 50 more patients being able to be housed in the ICUs. At least that's my interpretation of the data as we see it now. So this means that more people without COVID are able to get that specialized care in the ICU than just a few weeks ago. Looking at this pattern across Texas, and these graphs are very similar to the last graph. They're just one day, January 27th. That's the last date that we have data for from the state. And the red represents COVID patients in the ICU, and the blue represents non-COVID patients in the ICU. And the amount of red in any one of these trauma service areas across Texas, the Coastal Bend is one of those trauma service areas. The more red, the more pressure or stress there is on the ICUs in that trauma service area. So if you notice, we here in the Coastal Bend, Galveston, and Lubbock in the state seem to have the least COVID stress on our ICUs compared to other places, especially like Laredo and Victoria, which are close by, and San Angelo, which is a little bit farther away. They have some of the highest pressures on their ICU right now by new COVID patients. And I'll point out, again, as I have in previous weeks, that these are all scaled to the total number of patients that are being housed right now. So obviously there's more ICU patients in the Dallas-Fort Worth area than there are in the Abilene area, for example. And then we can look at the day-by-day trends in this same metric, not just one day, not just the last day we have data for, but all the days since June. And what you'll see when you focus across most of the state is that there's a peaking and downward trend. Recently, if you want to inspect the particular region of Texas that you're interested in, you can pause the video now for deeper inspection. Moving forward to the fatalities, we're at 988 fatalities confirmed in the Coastal Bend. These numbers come from the state counting death certificates where COVID is the primary cause of death. And then the second line represents 634 total fatalities in Nueces. Again, I'm pulling this data from the state, so there are a few more fatalities in Nueces County that have been reported since the 634 number. But these are counted the same way, but they're counted locally by our public health department. And the state will eventually also show those cases. So when we look at the number of new fatalities per day broken down by county, that's this inset up here at the upper left. You can see that Nueces is still increasing slightly in the number of new fatalities per day, but it's starting to level off. San Patricio looks like it's already peaked, and I'll remind you that for fatalities, they're reported on the date of the death certificate. So if a county only reports, say, cases once a week like San Patricio, that doesn't affect this fatality data. And so there is a downward trend in fatalities in San Patricio, but there is still an upward trend in some of the other counties in the Coastal Bend right now in fatalities. And overall, across the whole Coastal Bend, there's still an increasing trend in fatalities. Okay, wrapping this up, what does this all mean? Transmission rate is probably below 1, but might be just slightly above 1. What this means is this could be an indication that the fall-winter outbreak could be starting to subside. And the reason why I'm making this determination, or why we've made this determination, is that when we've seen dips in the past, it's been associated with a holiday, like at Thanksgiving. But this dip in January is hard to associate with anything, and so without any other explanation, perhaps it means that our transmission rate has indeed dropped below 1. Next, the new cases have declined over the past week. That's the pattern that's driving this estimation of transmission rate. Hospitalizations are peaking and slightly on the downward trend right now in the Coastal Bend area, and fatalities are still increasing. And I know that there's a lot of misinformation out there that you might hear when, say, new cases are trending in one direction and fatalities are trending in another direction. But this pattern that we're looking at is exactly what's expected, because new cases of COVID come before hospitalizations, and hospitalizations come before fatalities. So if we were hitting a peak, what we would see is exactly this pattern, where we see a decline in the cases. Hospitalizations aren't that far forward yet, so they're at the peak, and the fatalities are before the peak, just before the peak. So that's how to make sense of the different trends in cases, hospitalizations, and fatalities. And lastly, I want to remind everybody to stay vigilant. You want to try to avoid multi-household get-togethers and celebrations right now, because these are ways that COVID could be spread. Especially, you want to avoid indoor things like that. Wear your face coverings. It's recommended to do the doubling up if you don't have access to an N95 or one of those KN95 masks, but there's also those KN95 masks that are available out there. And they're pretty cheap from what some others on the task force tell me, and affordable. You're encouraged to continue social distancing, and remember, the farther the better. 6 feet is only far enough away for droplets that aren't airborne, which would mean that they can just hang in the air for an indefinite amount of time to hit the ground. Microscopic droplets, aerosolized droplets, can stay in the air for more than 6 feet when somebody's coughing, and they can stay in the air for quite a long time. And lastly, you're encouraged to get vaccinated if you're in one of the eligible groups of people right now. And the more people that we vaccinate, the faster that we get to herd immunity. So that's a report for this week. If there's any new trends that occur before Friday, we'll release slides and images and messages through our social media accounts, either Facebook, Twitter, or Instagram. And all three, our handles at CBCovid. And on Fridays at noon, we answer the questions that we get from the social media accounts. So if you have any questions, also you can post them to these accounts. We'll address them live on Fridays at noon, and that would be myself and the Public Health Director, Annette Rodriguez, along with the help of task force members Jason Lewis and Tiffany Anderson. So thank you very much for your time, and I hope that you all have a safe and a happy weekend.